So where do you feel most of your pain at today?
Right now I'm feeling it along here, along the back of the neck and top of the shoulder blade. That's where I'm feeling it the worst. So.
Okay, so right from here all the way up to the top.
Yeah.
Here. You're gonna bring your chin up a little bit. There it is. Oh, that was a good one.
Yeah, that was.
There it is.
Hey, yo.
Any issues into the lower back?
A little bit, but it's not anywhere near as bad. There's a little bit going on here, but not much.
It's more down into the center, to the mid back here. Okay, well let's
Along the right side specifically.
more so on that right side, and that's where you're feeling it most is on this upper shoulder blade and then down into the side. Now I know you said that the car they T-boned you from the center, correct?
Yeah, they did.
Okay, so then when that happened, you're saying that they're going roughly how fast again? You're saying?
Somewhere around 15 miles per hour.
Okay, all right. So that's enough to cause a significant shifting of the spine. All right, so. Yeah, right. There is where you're seeing some of the pressure right there. That's awesome. She's having a good time.
She's just being awesome cutie right now.
Alright. So yeah, we definitely are seeing some stress in that mid to lower back as well. There's 6 and then 7. 6 or 7, which is the worst of the
7.
two? 7 or more. So although we do feel some pressure up on C2, what I am going to do, just because of the structure of your neck, we are going to start with the lower neck here, just because you've lost a lot of that curvature. So we are going to start with that C6, C7 area. So I'm just going to tilt back just to see which one's more restricted here. 6. Yeah, it looks like 6 is where you're seeing one more restriction there. So we're going to start with 6. Here's 8.
Yeah, please.
9. 10.
I'd say 8.
Right there?
Yeah.
Okay. So this is going to be the sacrum. So 5. And then 1. Seems like right there is where it gets stuck there. Any soreness there?
Yeah, definitely.
Yeah, we're going to start with the sacrum. You're going to bring your chin up a little bit. There it is. Oh, that was a good one.
Yeah, that was.
Let's have you scoot on up just a little bit here.
Okay.
All right, let's bring this leg up right on up over here. Bring the knee up. There you go, right there. Smile. Hands right on over here. And then right down here. Perfect. All right, we're going to get right onto that sacrum right down below.
Okay.
And I'm going to roll you just a little bit here.
So I can roll off.
I won't let you fall. Relax that shoulder. Let it go. Drop. There you go. Oh, nice job. All right, we got one more for you here.
Okay.
We got one more, okay? And then hands right into the front here, just like that.
Okay.
Good. So we got that T8 right on the bottom here for you. Let's get this. 1, 2, 5, 6, 7, and then T8. All right, you're gonna breathe in for me and let it go all the way out. Dropping the shoulders. Nice and easy on that. Good job. That's the things you're looking for. Yeah, you're doing so good.
She seems so good as a little one.
Well. Alright, let's take a look how we're doing. Alright. That's a good start there.
Alright, because Sandra keeps making funny faces at her. I think that's helping.
That's helping a lot. That's awesome. Yeah, that's looking much better already too. Yeah, so that's going to be a good start for today. And so we got some homework to do. So the first thing is I want you to start icing for me, because ice will help to reduce some of the inflammation of that joint. Yeah, that's looking much better. So ice will help to reduce the inflammation of the joint. So basically, and especially for you, because in terms of your spine, you have that huge kink in that spine right here. So we worked on the sacrum here, and as we work on stabilizing the foundation, a lot of that stress is going to start to shift and move, and it's going to undo some of that stress that's been going on. So with that, though, you can feel some shifting and moving, and so ice is going to be your best friend. So
Okay.
15 to 20 minutes, get some ice.
Okay.
And just ice those areas that you might feel any soreness, okay?
Okay.
The second thing is, because we're getting movement into the joints, I want you to keep walking. Walking is going to be the best form of exercise for you. So get some walking in. You want to do the same thing 15, 20, 30 minutes, okay? All right. And so yeah, so that's what I would suggest is get some walking, get some movement in, but then also if you do feel any soreness, make sure we're icing if we have to, okay?
Okay.
All right, well, you're all set. Any questions for me?
One question from earlier I just realized I forgot to ask. You said earlier at one point that there was some permanent damage.
Mhm.
What was the permanent part about
So
it?
some of the permanent damage is something that we'll see in your neck. You remember how I told you how those bones are starting to grow a little sharper in the front?
Yeah.
Yeah.
That doesn't come back on.
Yeah, and then we do have a little bit of thinning of the disc here in the lower part, so that is also
Okay.
that's also something that we'll see that we can't undo, but we can at least slow down the progression of that if we have to, okay? All right, well, you're all set. Thank you for being here. You did such a good job.